News Center Maine is partnering with the-maine-monitor to bring you some of the reporting being done by journalists at the independent nonprofit publication. We'll be bringing one of their stories to you each Monday. Today, we're taking a look at the opioid epidemic. Usually when we talk about it, we share how younger Mainers are affected, but older Mainers are certainly not immune to the issue. Here to talk more about those struggles is Rose Lundy, a senior reporter with the-maine-monitor. Thank you for being with us.
Thank you for having me.
Of course. Let's start with this one. What led you to actually look into this issue, and what did you find?
Yeah, so I saw some data that we are nationally seeing an increase in older adults struggling with opioid use disorder. There's been a threefold increase between 2013 and 2018. And so that made me think, Maine is the oldest state, so I just wondered what we're seeing here. So I talked to a bunch of people across the state for a couple months and found out that we are seeing increases in pockets of the state. And then notably, we took a look at Medicare claims data to see if we could find some data on this. And we looked at Medicare recipients in Maine who are 65 and older who are receiving buprenorphine as part of their treatment for opioid use disorder. And that number has increased 70% from 2019 to 2023. So it's a pretty big jump. It is only about 450 people across the state, so it's important to put that in context. So some providers we talked to did not see the impact of that, but some primary care doctors and treatment providers across the state said they're starting to see that increase in their day-to-day. And so, they're worried that this could be a trend going forward.
You said there are pockets in the state. Are there similarities in those pockets?
Primarily I talked to a lot of people in the Bangor area who have seen some increases, and I even spent some time with a street medicine team up there where they're seeing anecdotal increases. But then there were a number of providers across the state who I talked to who have not seen an increase. And notably, it's important to notice that overdoses are plummeting in Maine, and older Mainers, 65 and older, make up a relatively small portion of those overdoses, especially when compared to other age groups. So, some of the experts I talked to said, well, we have limited resources, so we have to focus on the population that are most impacted.
And what's different about treating an older Mainer with an opioid disorder?
Yeah, there's some really important things to keep in mind. I talked to a couple of primary care doctors who say that opioid use can mimic some of the symptoms of aging, and so things like memory loss or loss of function, falling, so that can be kind of hard to identify. In addition, older adults often have more health conditions, and they might have more medications that can interact in complicated ways with opioids, and they might have more chronic pain that is hard to find a non-opioid alternative to treat. And so those are some important things to keep in mind. Also, a lot of the people I spoke to said that older generations struggle with more stigma around opioid use than younger generations, which means it can be harder to connect with that population and help connect them to resources. But ultimately, we are an old state, we're getting older, and so some of the people I talked to said that this could be a problem going forward and something that we really need to keep in mind.
Something to follow. Rose Lundy, thank you for coming in and talking about it.
Thank you for having me.
Of course, you can read the full story at the-maine-monitor.org.